Welcome to the 5-Minute Drill Down. I'm Dr. Phil Klein. Today we'll be talking about a procedure called deep margin elevation, or DME for short. But first, a quick thank you to our sponsor, Bisco, where adhesion is our passion isn't just a motto, it's a mission. They offer an outstanding line of adhesive and restorative products. Check them out at bisco.com. Now, all of us restore teeth using indirect techniques, and we all know what it's like to do so when the margin is way down below the gum line. They're a pain in the butt, especially on the proximal aspect of a posterior tooth. We all know how challenging that can be. Rubber dam isolation becomes difficult, adhesion is compromised, and worst of all, marginal integrity often suffers. That's where deep margin elevation comes into play. DME is a restorative technique introduced by Dr. Pascal Magnier. The idea is simple in theory, but precise in execution. Instead of chasing the margin subgingivally with your final indirect restoration, you elevate the deep margin coronally using a bonded composite resin. This raises the margin to a more favorable supragingival position, making it easier to get a better impression, especially if you're using an intraoral scanner. So essentially, you can do your indirect restorations like an onlay, inlay, or crown with better visibility, isolation, and control. So, why consider deep marginal elevation over other options like crown lengthening or surgical approaches? Here are some big reasons. First of all, DME is minimally invasive. It avoids the need for flap surgery or gingival removal, preserving the attachment apparatus. It also dramatically improves isolation. Elevating the margin supragingivally means easier placement of a rubber dam and better control over moisture. This allows us to achieve better adhesion at the new supragingival restorative margin, which is critical to achieving a long-term seal and staving off recurrent decay. And then there's conservation of tooth structure and the elimination of healing issues after crown lengthening. DME allows you to maintain more natural tissue, which is always a win in biomimetic dentistry. Let's not forget, DME is time and cost efficient. Compared to crown lengthening or orthodontic extrusion, DME can be faster and more comfortable for the patient. And in cases where you have a fractured tooth below the gum line, deep marginal elevation is an ideal procedure, obviating the need for the typical more aggressive crown lengthening that often results in compromised aesthetics and loss of attachment. Now let's talk about the elephant in the room. DME is a technique-sensitive procedure. Here are a few critical points to get it right. Isolation is non-negotiable. A rubber dam is essential for predictable bonding and to protect the gingival tissues. Matrix placement is also crucial. A tight seal at the cervical margin is needed. Sectional matrices with a wedge or ring system often provide the best results. Use of a flowable or preheated composite helps adapt to the deep margins, reducing the risk of voids and overhangs. And layering and curing properly is key to avoid polymerization shrinkage and ensure marginal integrity. Careful finishing and polishing at the gingival margin is essential to avoid inflammation and maintain periodontal health. Final thoughts. Deep margin elevation isn't for every case, and it demands precision. But when executed correctly, it offers a conservative, biologically respectful, and predictable alternative to more invasive procedures. It's another powerful tool in the toolbox of modern adhesive dentistry, and it aligns beautifully with the movement toward minimally invasive biomimetic approaches. We appreciate our sponsor Bisco, and thank you for joining us on the 5-Minute Drill Down. I'm Dr. Phil Klein.